Okay, so most of y'all are not gonna make it in for therapy. So this is what we're gonna do. We're gonna show you how to do this at home as best you can. Will it be as good as having a therapist there? No, but I'm gonna help you out. So let's say we're gonna start with the neck. We're gonna start with that because everybody's got, oh, my neck hurts, my neck hurts. So we're focusing on if this side, the side of your neck hurts, not down here in the clavicle area, not along the shoulder area, but if you're feeling pain and discomfort on this side of the neck, this side or this side. All right. So you can do this standing up. I recommend you do it lying down on your back because a lot of this is because you need to relax. Most of you, I say relax, you don't know what that means. But when you're lying down and you're just about to fall asleep and you're just completely lifeless, that's just about it. You want to be relaxed. You don't want to be trying to control or hold your phone. None of that. Just relax. Completely just loose weight, heavy, basically that. So we're also going to talk about real quick types of the ways you want to do this. You can either, like, let's say for instance, this cord is your muscle. If we can go straight in to the muscle this way, we can also potentially go this way to the muscle if we can kind of dig in and push this way, but we can also do it on the reverse side. We can do it this way. So this is a muscle, depending on where you're at and if you can get to it and the type of it, because sometimes it don't always work like that. So, but that's just a visual for that. So anyway, for the neck here, you're gonna lie on your back, relax, neck, whichever side. If it's this way, if it's on the left side, this is my left side, we're going to turn our head towards that way. Now, if it hurts when you turn, we're going to turn just to the point of where it hurts. Now, get a pillow. Nice pillow. You don't want to put it behind your back. You don't even want a pillow on the bed. You want to be flat. Okay? Now, if you can't be flat, this is where we're working to, because the best thing you can do, if you can look up, then likely you'll be able to turn left and right. If you can't turn left and right, you probably have a problem looking up. So anyway, you get a pillow, you put it on this side of your head, not behind your head, but on this side of your head, and you turn to the point where just where you feel the pain, just where discomfort, and you place the pillow there, and so you can just relax, and you don't have to worry about going too far or holding your head. So you're just at the point where you can completely relax, no pain, but you're slightly turned. Okay, so you're relaxing. Now your opposite arm, let's say this side, because you're laying down, you're going to try to be weightless. So keep this arm relaxed and slowly move this arm up into the point where you can put your hand on it on that area comfortably, but you're not tensed up and your head's still turned and everything's still relaxed. You want to remember the most important part of this is being relaxed. So you want to slightly push into the muscle. So instead of like I said, we're pushing straight into the muscle. We're going to push across the muscle this way. So we're going to just move it back. So we're moving back this way. It's the easiest way because it doesn't always feel that great, but it's a little bit easier and less. So you don't want to necessarily dig in, just a little bit of pressure and slightly push. Okay? You can also use your fingers and grip and pull the other way if that works, but you want to find that area. Now, mind you, this whole section is free game for helping this to relieve the pressure, for relieve the discomfort. What the answer is definitively, can't tell you from here because there's a lot going on with you, there's a lot going on with me, there's a lot going on with everybody. So figure it out. Or come in for therapy. Anyway, so I would save this for last. Before you do that, if you have one of the massage guns, I don't have one in front of me, unfortunately. It's upstairs. But use the massage gun along the shoulder here, along the chest. Now, if you've got the flexibility to reach back and use it along the top part of your shoulder and back, that will also be advantageous for you. Absolutely. But now, your starting point, you know, dealer's choice. I usually like to start with the pecs because it's a big muscle and people always have it. Because if it's pulling this way, if it's pulling down, like look at the shirt, it's pulling down this way, you see how it's pulling up here, but also pulling here. So we've got a variety of things that could be going on based on one the the symptom that you're having. Now, that's just one symptom. There could be another one creeping up. There could be another one behind that. And that one behind that could be the one that's all the things that's got the actual problem that's going on. Can't tell you from here. You can figure it out. Maybe. Maybe not. But I'm giving you some tools. So anyway, use the massage gun first. Loosen all this up. Remember, you're lying on your back, you're relaxing. Your head is in a good position. You're not strained. Now again, if you can't go all the way back, then get a towel and start folding it and build it up to the point where you're just level, to the point where it's just comfortable. It's not uncomfortable, and it's not like you're not low, you're not past that point, you're not too high, you're not, oh, I've got a pillow, I feel so like I'm on air. No, I want you low. I want you to be able to lay flat. The whole point is we want to get to where we're laying flat. Put a towel under our neck, so we're creating that arch, that curvature in our neck. We want that. We don't want a flat neck, because that leads to this, and hunched over like you see. We don't want that. We don't want that. So the only way to do that is to make sure you're able to look back. So anyway, lying on our back, you got to get your level up, all that. So you want to work the pec. You see this motion? Light, easy. But remember, you're relaxed, you're on your back. Now, if you need to bring like your arm, now if you're lying down and your arms feel like they're tight, like you're straining, like put a pillow down. Another pillow like on your hip. Put a pillow in between that and rest your arm. Does that make it feel better? Does that feel less pressure? Great. Use the massage gun again, and then with this motion, light. You should feel a slight amount of, you should feel it. It shouldn't be like, oh, that's nice rubbing. No. You should feel like, I can feel that myself, because, doing push-ups, hitting the pecs, you should feel that. Because right in here is usually always a very tense spot for people. So when you're trying to raise this up, raise your arm up, you can feel it straining. So I can feel it all the time in clients. So you're going to work it like this. So if you want to go that far, go ahead and do it. Grab that. See that in there? You want to grab that. Use your whole hand. Get up in there. Deep breath and relax. All of this is, you want to relax. You want to get the muscles to reset. It's easier for somebody else, but if you're at home and you're going to do this yourself, you've got to focus your mind on knowing how to relax. Okay? So, I think that might be enough for today. So, pec is the big move. This is a nice soft move. This is where we're ending up, but you can work this in between here. We've got the anterior delt here. We've got a bunch of posterior stuff we can do too. You may need some tools or a different setup. Like I said, when you got to use these pillows to make sure your body's not strained, it's a lot easier, but it's also like you've also got to think outside the box a little bit. Just understand the concepts. But you don't want to be strained when you're laying down. You want to feel comfortable. You want to feel like you're able to relax. So start being mindful of these things as we go on this road to you doing some self-recovery, because that's going to be the best thing, because that's going to be how you learn what's going to work for you. That way you can communicate with the therapist like, hey, this is what I've been doing, this is what isn't working, this is what hasn't worked, and then maybe you guys can talk about why and what you can do and go on from there. So good luck. I'll see you guys out there.